Hello, I'm Dr. Lesley Goff. I'm a musculoskeletal and animal physiotherapist, and today I'm going to talk to you about range of motion exercises for your dog. If you've had orthopedic surgery or spinal surgery, or you've just sustained an injury that requires rehabilitation, you'll usually be sent to a physiotherapist for rehabilitation, and this involves, amongst other things, the prescription of exercises. And exercises often include range of motion exercises. It's the same in dogs. If your dog has undergone orthopedic surgery or spinal surgery, or is just recovering from an injury where rehabilitation is required, you'll often be sent home with a list of instructions, and these will often include perform range of motion exercises on your dog. And in my experience as an animal physiotherapist working in canine rehabilitation, I've found that range of motion exercises are often poorly done at home. And this is for a number of reasons, but generally it's because the reasons behind doing the range of motion exercises and how they are done is not well explained. So at the end of this video, you'll have more of an understanding of how to safely perform range of motion exercises for your dog. Before I start, I'd like to introduce to you my models. This model here is Amani. She's a Siberian Husky and is part of Dirt Paws Racing, which is our dryland sled dog racing team. We also have Storm, another one of our Huskies, floating around, and we'll just see who is happiest to cooperate when I'm demonstrating some of these techniques for you. Range of motion exercises are a very important part of rehabilitation because we have to restore movement when there's been pain and impairment. And in the case of surgery, be it orthopedic surgery or spinal surgery, or even a sporting injury, usually swelling and sometimes a sutured wound. When we perform range of motion exercises of the limbs, we're taking the joints through their normal range of motion. And this has the benefits of helping with circulation, getting rid of swelling. It's good for articular cartilage health. It also can help to relieve pain and help prevent the formation of adhesions and some scar tissue. So when a dog is undergoing rehabilitation, they've usually had an injury, so you also have to be aware that the dog may be in pain. So it's really important to know how to handle the limbs for range of motion exercises so that you're not causing the dog any more pain and discomfort. So let's start with the front limb. Before you try to do range of motion exercises, it's a good idea to know where the joints are in the dog's limbs. So when we're looking at the front limb, we've got the wrist joint here, the elbow joint here, and the shoulder joint is here. And it's important to know where the joints are so that when you're handling the joints in the range of motion exercises, you're not squeezing or blocking the joints, because that could prevent range of motion, but it could also cause the dog pain. So hand holds, or how you handle the limb, is really, really important. You don't ever want to squeeze or grip the limb because that could cause discomfort or pain for the dog. The limb should be comfortably supported with a firm yet gentle pressure from your hands. And ideally, the limb should be in a neutral plane that is not stretched away from the dog or across the midline of the dog. So I've got the limb comfortably balanced here, and I'm going to bend up all those joints of the forelimb into flexion, and then I'm going to straighten them all out. And how I do that is to support under the wrist and underneath and at the back of the elbow. And we're bending the joints all the way up into flexion, and we're straightening them all the way out into extension in neutral. And what you'll notice also is that these range of motion exercises are rhythmical. And that's because they differ from stretches, and they have a different purpose to stretches. So range of motion exercises are wanting to emulate function in the dog, and that is the cyclical nature of walking or gait. So that's one of the reasons we perform these in a rhythmical nature. The other reason is that it's thought to improve the nutrition of cartilage and help circulation further with the rhythmical application rather than holding in one position. So we've seen how all the joints can flex all the way and straighten all the way in this direction. But the other ranges of motion that are important for dogs' gait are what we call protraction and retraction in an animal. Protraction is the movement of taking the limb forward. So we've got the forelimb comfortably forward. And we are repeating that rhythmical nature of the application. And again, you'll notice that my hand holds are relaxed and I'm not compressing or squeezing any part of the limb there. Because remember, when a dog has had surgery or following an injury, they'll most likely have swelling and a shaved area and also maybe some sutures of a wound. Opposite to protraction is retraction, and important again for normal gait in a dog. So this time we can hold under the wrist and the elbow. I tend to swap hands here so we can guide the elbow and the shoulder back towards the rib cage without putting any undue stress on the ligaments and the joint capsules. So that's quite a comfortable range of motion exercise for this dog. And dogs need to change direction, and so their limbs move across underneath them and out to the side. So we can also perform a range of motion exercise into what we call abduction, that is the limb moving away from the body, and you can see that the limb's held in a neutral position and it's quite comfortable for the dog. So in summary, for the range of motion of the forelimb of the dog, we have the flexion and extension of the limb, of all the joints of the limb, to their comfortable end of range. We have the protraction movement, which is taking the limb in a forward direction. We have the retraction movement, which is taking the limb in a backwards direction. So remember, all three of those movements constitute range of motion of the dog's limb. So we're looking at range of motion of the joints, but even when we take the limb into protraction and retraction, it's even helping to mobilise or keep healthy some of the muscles that attach to the spine and the spine itself. Usually with range of motion exercises, we would start with, say, 6 to 10 repetitions in a very comfortable range for the dog. And then as the dog improves and their pain levels decrease and their function increases, we can increase that amount of repetitions. As always, you'll be given guidelines by your animal physiotherapist and your vet, and they may even say don't put the dog's limb into a particular range of motion depending on what their particular injury is or the surgery they've had. But at least now you can understand what constitutes range of motion for the dog's forelimb. The one I showed you where you take the dog's limb away from the body is generally prescribed more for specific shoulder or elbow conditions. But again, if I've demonstrated that to you, you know how to perform this range of motion exercise if need be. So now we're going to look at the hind limb. First I'm going to go through a bit of anatomy, then I'm going to show you how to perform range of motion exercises on the back leg. So looking at the joints of the hind limb, we have the hock joint, which is the same as our ankle joint. We have the stifle joint, which is the same as our knee joint. And you can see in the dog, the hock joint or the ankle and the stifle or the knee are coupled in their movement. If one bends, the other one has to bend as well. Moving up from the knee joint, somewhere in here amongst all the fluff is the hip joint. Okay, and that's a ball and socket joint, just like our hip joint. So when we're doing range of motion exercises for the dog's hind limb, again, we want to bend and straighten or apply movement to all those joints. So hand holds, my hands comfortably underneath the inside of the dog's stifle and comfortably supporting the paw area of the dog and underneath the hock. So you can see how nicely all those joints in the dog's hind limb are bending all the way and straightening all the way, and it's in no way uncomfortable for the dog because I'm not gripping around the joint. I've got very comfortable handholds. Just like in the forelimb, we have backwards movement of the limb, which in an animal is called retraction, and we have forward movement of the limb, which is called protraction. And these ranges of motion are also important when you're performing range of motion exercises of the dog's hind limb. In retraction, or taking the dog leg back, I have my hand comfortably underneath the stifle and supported underneath the hock. And we're just guiding the dog's leg back behind the dog in a way that's comfortable for the dog. It's extending the hip, the stifle and the hock, just like a functional movement in gait. To take the dog's limb forward, here's the stifle of the knee. We can bend it up towards the ribs and then gently straighten at the hock. And that's not stressing the joints in any way. And we're able to apply that same rhythmical type of movement. Just like in the forelimb, dogs need to change direction so we can take the limb away from the body in a rhythmical range of motion movement. Again, just as it's more likely to be used for the shoulder in the foreleg, this range of motion exercise is more likely to be used just for the hip, and you'll be guided by your veterinarian or your physio in whether it's safe to do this part of the range of motion exercise. So in summarising the range of motion exercise for the hind limb, the prescription of the exercises is similar to what I discussed for the forelimb, and always check with your vet or your animal physio as to what's appropriate for your dog and their injury and rehabilitation. So in the hind limb, we have the flexion and extension movements, we have the retraction movement, and we also have the protraction movement. And this also highlights where we're not just affecting the joints that we're specifically moving with the range of motion exercise. So if I'm taking a Marnie's hind limb into a retraction motion, we're also affecting muscles that run along the front of the spine, so we can help with back movement. And if you think of a dog limping around on three legs or protecting itself, they're going to get stiff in other areas of the body other than where they've had the primary injury or the primary surgery. So that's where range of motion exercises can help secondarily with other areas. Similarly, when I protract the whole limb forward, I'm affecting the muscles across the top of Amani's pelvis and her back. So range of motion exercises in rehabilitation are important for all the benefits I discussed earlier pertaining to circulation, range of motion, prevention of scar tissue, but they generally help the dog to move well and stay well. So if you, as an owner of a dog, have been to your vet and you've been prescribed ROM or range of motion exercises, I hope this guide has given you an understanding as to why we do range of motion exercises and how to do them. My guide is in no way prescriptive. Please always be guided by your own vet or your own animal physio as to the frequency and to how to perform these, but at least you have an idea of how important the hand holding is and how important it is not to force a joint to its end of range, just to take the limb and the joints through a range of motion that's comfortable and acceptable for your dog, especially when they're recovering from an injury. Performing range of motion exercises can also be challenging in some dogs. Not all dogs want to lie still like a Marnie, and you might have a very big dog or a very tiny dog, and those factors in themselves can provide challenges. But I hope that you can take away the fundamentals of why we do these range of motion exercises and how to perform them safely and effectively. Thank you.